Welcome to the Karim Chubin Podcast. This is my first podcast, so I hope you're going to enjoy it. It's the beginning of a sequence. This is a journey for those of you who know or those who don't know. I tend to regard myself as a whisperer. I'm a passionate naturopath, nutritional rebel, anthropologist. I travel the world, and I love taking health treasures from the East, namely from the former Soviet Union, and whispering them to the West and vice versa, taking breakthrough discoveries, scientific discoveries from the West and whispering them to the East, so bridging cultures. The aim of this podcast is centered around life stories, your story, our stories, and sharing them in a fun and dynamic way in order to empower you. On today's podcast, we have a very, very special guest, my first guest, Dr. Karim Dhanani. Yes, his name is also Karim. Dr. Dhanani and I met almost a year ago in Chicago at a training in what is known as live blood or dark field microscopy. And Dr. Karim Dhanani, welcome on this podcast. Welcome from Ontario.
It is an absolute pleasure to be here. It has been a year since we've known each other, but I feel like we've known each other for lifetimes. So it's a pleasure, an absolute pleasure to be here.
Likewise. Thank you for making the time. I know it's very early in Canada. Karim, could you share a few initial elements about who you are, how you got to naturopathy, and what naturopathy means to you, and how you practice today holistic health in this very unusual and unconventional manner, which makes you so special?
Absolutely. I have been in this field for about 20 years, and it's interesting that we always look back at our lives and we wonder, what could I have done differently? What might have I changed? What new paths might I have gone left rather than right? Where would that lead me? Should I have taken the blue pill, for example? And I look back at my life from a healthcare perspective and my mechanism of how I treat patients and what I actually do for a living, and I wouldn't change a darn thing. I absolutely love what I do. I am thrilled with the outcome of what's happening in my life from a naturopathic biological healthcare perspective. So I would say that in naturopathic school, so in fact, if I backtrack even a little bit further than that, I was the kid in high school that never went to class. I was the kid in the cafeteria playing cards. I was the kid that had to walk around from class to class with an attendance sheet in my last year because I had to meet a minimum requirement of being in class to graduate. I understood math, physics really quite easily, so I would just walk into the test, write the exam, and leave, but having never have gone to class. So needless to say, I limped into university not really knowing what I wanted to be when I grew up. And then I hit this course called biology, cell biology, at the University of Waterloo, about an hour outside of Toronto, and I fell in love. It was truly my first love. I adored the information. I devoured the information, and I took over. I loved biology. I was sitting there with the teacher every hour that I possibly could in their office hours, learning as much as I possibly could in this framework of biology. Needless to say, in my second year, I was TAing second year biology courses. So I really did quite well. I thoroughly enjoyed it. And I went into, within 5 years, I got 2 degrees at the University of Waterloo. And then again, it got to a point where I have to go somewhere further. I have to go somewhere deeper. I have to take all this information of how I understood about biology and delve into it with healing patients somehow, finding a purpose for my life. So I applied to medical school. I applied to optometry. University of Waterloo was the only English-speaking optometry school at the time. And I remember marking a test for a student, and I gave her a 9 out of 10, and she was in tears because she might not be able to get into optometry school because it was a very high-ranking application. And so I decided to apply, got into a bunch of different programs, and then I had to sit back and decide what I wanted to be when I grew up. And I decided on naturopathic medicine. I went to the Canadian College of Naturopathic Medicine. How I got into naturopathic medicine was basically an elimination process. I went and I got into med school, I went and saw my medical doctor, and as lovely and as kind-hearted as he is, our systems are broken. Within 3 or 4 minutes, you'd have a prescription and you'd walk back out. Next patient would walk in. Within 3 or 4 minutes, you'd have a prescription and you'd walk out. And it became this revolving door of never really looking at what I believed would be the root cause. So then I went to a good friend of mine who was an optometrist at the time. And, you sit in front of this phoropter. What can you see better? 1, 2, 2, 3, 3, 4, 4, 3. And I would die being in this profession. Although they do really good work, but it seemingly to me at that time was extremely boring. No offense to the optometrists out there. And so then I got into naturopathic medicine. I spent...
Sorry, just to intervene, to sort of make it maybe more understandable for all of us. How do you define naturopathy and naturopathic medicine? So just
good point.
I'm going to sort of guide you on this, because let's just, I need some understanding here. I need a bit, although I'm a naturopath myself, I'd love to have your
interpretation of it. Yeah, it is a very different sort of philosophical framework. So I would look at the medical system. They do an incredible job at acute medicine. You get hit by a bus, that's the first place you go. Trauma medicine, they do a fabulous job. When it comes to chronic disease, you have to look at a different system of thought. It's like comparing apples to oranges. You never take acute care medicine and try to take that framework of thinking and utilizing it on chronic disease. They're two different systems. And so naturopathic medicine, alternative medicine, complementary medicine tends to work a little bit better with more chronic disease. I believe we don't use the same framework of diagnostic tests for acute medicine as you do for acute medicine as you would for chronic disease.
So, Dr. Dhanani, what you're saying is that from being this student who was not attending his classes, who was quite good at the natural sciences, who all of a sudden discovered a passion and a keen interest in cell biology, you got interested in applying biology to helping people? Or was the interest slightly sort of different, and you wanted to help people, but you didn't want to help them by wiping out symptoms and giving them drugs, and you were interested in the root causes that underlie diseases? I mean, what got you to become a naturopath, really? I mean, if we just sort of zoom in.
Yeah. I think trying to find root cause is a lovely catch-all term that so many people use, but is rarely truly put into practice. When you go to acute trauma care, it's very clear what they need to do. They need to mend a broken bone. When you have a chronic disease, looking after, for example, Lyme disease, for example. If we look at Lyme disease, it's not just the offending agent that comes into the body that wreaks havoc. There's also an environment that allows that bacteria, virus, fungus, spirochete to grow.
So are you saying you got very interested in how to support the environment, the internal environment in which various bacteria, germs can thrive? So how to map that environment and how to alter that environment to make it less hospitable for these unwanted guests to thrive. Is that maybe a good way of putting it?
Completely. I think that there's an environment that things like to grow in. And if you provide that environment, it's going to grow. I think the vast majority of people, if you look in Europe, for example, there's a large population that have Lyme disease, but have no symptoms associated with Lyme disease. And so rarely is it the offending agent, although it's important to get that offending agent out. We cannot get it out 100% out of the system. We get it out 99% and hope that the immune system modulates itself. But it's really the environment that allows these infections to grow. That's key.
So you were conquered intellectually, so to speak, by the tenets of naturopathic medicine. Then in your practice, did you start seeing, and are you still seeing, if you're still practicing actively now, are you seeing more Lyme patients, more cancer patients, more people with chronic fatigue, or people with weight issues, or cognitive issues? Could you give us a little bit an understanding of who comes to you and how you address them, practically speaking, today, please?
Sure. Thank you. I don't feel that that focusing on one disease process is benefited by terrain medicine alone. I think terrain medicine handles a lot of disease processes. So if it's from Alzheimer's and Parkinson's and cognitive disarray versus an offending agent like Lyme disease versus an offending agent like cancer versus mitochondrial function, versus GI complaints, a lot of those can be treated via terrain medicine, via biological medicine.
Now, just one question here, because my understanding of naturopathic universities or colleges in North America, and I know a handful of them in the US, and I know of some in Canada, is that in order to receive accreditation and recognition from conventional allopathic post-World War II Western medicine, which is symptom-orientated and works, as you rightly pointed out, really well with acute stages, it took a little turn and became known as what is known today as green allopathy. So wiping out a symptom, but with a vitamin, a herb, or a probiotic. Do you practice that way? What is terrain medicine exactly? How does it translate in practice,
Well,
please?
this is truly why I left naturopathic medicine after my first year. I did 1 year, I got accepted, I loved it, it was fabulous, but we never got into the reason as to why. Why is it that two people that got exposed to the same virus, for example, one got sick and the other one did not? We spent most of the time looking at origin, insertion, and function in naturopathic medicine. And oh, don't take a Tylenol. Here, take an herbal Tylenol. We spent so much time looking at alternative approaches so that we can take one and replace it with something else without looking at the root cause. That it was extremely frustrating for me. So I left. I decided that this was not the path for me. I went to Germany, got some training, went to Africa, worked in Africa, came back.
So you got this,
and then,
you got this illusion with the conventional Western medical medicine model.
Yeah.
You got into naturopathy. You quickly understood naturopathy was, perhaps intellectually a bit better, but then practically speaking, it was replacing a drug with a herb, and it was still working on symptoms and not explaining what you just mentioned, which is why two individuals exposed to the same virus, one will get sick and the other one not. And then you got interested in terrain or environmental medicine, to put it differently, or terrain medicine. And then you went to Germany and discovered, what is that?
and even truly, it was the systems that, maybe it's not so much the school. I think the teachers are kind, caring, compassionate. I think our healthcare system is met with a lot of people that have the best of intention, but I think the system overall is broken. And so in naturopathic medicine, I was very disillusioned. I thought I was in a place where I could figure out why systems work the way that they work. And if you know why, not necessarily just how, but how is not difficult. That's in conventional medicine. Biochemical reactions, very, very easy to sort of address. But why? I could not get the answer why. And because I didn't get the answer, I had understood, one of my mentors at the time that allowed me to get into naturopathy, that grew my interest in naturopathic medicine, was a biological practitioner by the name of Dr. Alexander Wood. Dr. Walter Sturm is one of them as well. Genius, absolute geniuses in this field. And as I delved deeper, I learned about Dietrich Klinghardt and Thomas Rouse of the world and Ralph Ottmeyer's of the world. They're just lovely, wonderful, brilliant people, but I needed to learn from them. And so this is why I left after my first year, went to Germany, and learned from some of the brightest minds in the framework of biological medicine. So biological medicine is essentially looking at terrain medicine. You have the opportunity of replacing one pharmaceutical with a nutraceutical drug, with the understanding that you are looking at root cause. Now the question is, how do we look at root cause? What are the tools? What are the technologies? What are the mechanisms? What are the frameworks that we look at root cause? And it's not on a blood test. As much as we want to believe that we glean everything from a blood test, we can glean some things from a blood test, but really what we need to do is we need to get information from the body. The information from the body that we receive is paramount and key in understanding how a body is going to respond to therapy, regardless of what the therapy is.